So for Miracles Asia, it's, we look for a certain type of client, and that client is usually, older than 25, usually the older than 28. We're a little bit older crowd, we're a more mature crowd. Usually our clients, and this doesn't disqualify people, but typically our client is, a working professional, business owner, has a family, has some sort of stability in that it's not serious mental health. We treat mental health, depression, anxiety, trauma, ADHD, and these things as underlying conditions. That's part of our job. But if it goes into more what's called subclinical mental health, we find a better place for them because we're just not equipped to treat it. So we look for that. We look for willingness. Our clients come in with an open mind. They're not shoved in there and forced into. We don't take clients whose, parents are shoving their kid into rehab or, court ordered, and they don't want to go, stuff like that. We don't, we're just not the right place. We will, again, refer them to somewhere else or look for a place for them. And someone who's coming in with a little humility. I'm not saying like begging and pleading on their knees for rehab, right? But like coming in and saying, okay, I'm going to listen to you guys. I'm going to give it a shot, and those are the things we look for. And then, of course, substance use. We're an addiction treatment center, so we treat co-occurring disorders, mental health, but we don't treat only mental health. So if someone comes in, we get inquiries all the time, people reaching out, and I find places for them. But, someone who comes in and says, I'm dealing with trauma, and, are you dealing with any substances? And they say no. Well, that's not our client. We will find a place for them, or refer them somewhere. But that's not our client. We are an addiction treatment center, so substances and behavioral addictions, so gambling, sex, occasionally gaming. So those are the things. Is there an addiction? Is the person willing? Do they have enough mental stability to do the program as it exists? Once they're obviously detoxed and stable and all of that. Those are the biggest things. We look for age a little bit. We do take younger on occasion, but the person has to be pretty mature and really want it. And, anytime, we also prefer if they have skin in the game. So if they have, some part of the payment process that they're doing or paying in full, a lot of our clients, 80% of them, pay themselves. The other 20%, are paid by insurance or family. But when the family's paying, we have to be extra sure that the client themselves want it, because otherwise, we're just taking money and having someone here that doesn't want to be there, and that's bad for the group. The thing with the other clients is very important, and it gets overlooked in conversations a lot of times around going to rehab, like what are the other clients like, but it's really important because you don't want to be in a group of people where you have one person dealing with something that you just can't relate to, another person who doesn't want to be there and being angry. You want to be around a group of people who are being open, talking about their issues, dealing with the issue, and it becomes very powerful for you. And you create a lot of bonds with these people too, and you want to be around your demographic as well. It's, it helps, right? It helps you to relax and kind of deal with things. So